Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Hey everyone, welcome back. So bird flu, right?
Yeah.
It's been all over the news lately.
Yeah?
And I bet you're wondering what it all means, especially for us humans.
Yeah, definitely.
Well, that's what we're diving into today.
Okay, sounds good.
We found this really interesting article from Medical Xpress,
Oh, cool.
and it's all about this H5N9 strain, which seems to be causing a bit of a stir.
Uh-huh.
So by the end of this deep dive, you'll be totally up to speed on all the key facts about H5N9.
Great.
You'll have some really interesting insights to share, too.
Awesome.
So, to kick things off, I think it's important to clarify something.
Okay.
Bird flu itself isn't new.
No, it's not.
It's been around for ages.
Decades, actually.
Yeah, decades, you're right.
There are these two main types we hear about a lot.
Right.
H5N1 and H5N9.
Yeah, those are the big ones.
And this article we're looking at today really zeroes in on that H5N9 strain, which, has been making headlines recently.
It has.
Especially because of this uptick in cases they're seeing among dairy workers.
Oh, yeah, I read about that.
In California's Central Valley.
Well, California dairy workers.
Yeah.
That sounds a little close for comfort.
Right.
Should I be worried?
Well, that's a good question.
Like, is this something that's going to affect my everyday life?
The article actually quotes an ER doctor and public health official,
Okay.
Dr. Rais Vohra.
Oh, interesting.
And he's dealing with this outbreak firsthand right there in California.
Wow, so he's right in the thick of it.
He is.
What did he say?
He emphasizes that, while this H5N9 strain definitely warrants close monitoring,
Right.
it doesn't seem to be any more dangerous to humans than the strains we've seen in the past.
Okay, well, that's a relief.
At least for now.
But hold on. Viruses are always evolving, aren't they?
Right.
So how can we be sure that this strain won't suddenly become more dangerous?
That's a great question.
Like, could it mutate?
Yeah. Well, it's true.
Yeah.
Viruses change all the time.
It's in their nature.
It's in their nature,
Right.
Exactly.
I mean, it's not like they wake up one day and think, I'm going to become a supervillain.
Huh. Right.
But seriously, how does it work?
Wow.
Let's say, hypothetically, I get the regular flu,
Mm-hmm.
and then someone sneezes bird flu on me.
Okay. Yeah.
Do they, combine
Interesting.
into some kind of mega flu?
Yeah. You're actually talking about something called reassortment.
Reassortment.
Yeah. It's where different flu viruses can swap genetic material.
Oh, wow.
Kind of like shuffling a deck of cards.
Yeah, so they mix and match.
And they mix and match their genes.
And that creates a whole new virus.
It can, yes.
With unpredictable characteristics.
Exactly.
Wow, that's a bit scary.
That's why researchers are keeping such a close eye on this H5N9 strain.
Makes sense.
Because of that potential for it to mix with other flu viruses.
Okay, so we know they're worried about this mixing thing,
Mm-hmm.
but how is this bird flu actually spreading?
Well, how contagious is it?
Yeah. Should I be avoiding people who eat chicken?
Let's not get ahead of ourselves.
Sure.
Think of it this way. It's like the common cold.
Okay.
It spreads through respiratory droplets.
So coughs and sneezes.
Yeah, when someone with bird flu coughs or sneezes,
Uh-huh.
those droplets can get in the air.
I see.
And if you breathe them in, you could get infected.
Okay, that makes sense.
But, and this is good news,
Okay.
at least in the U.S.,
Yeah.
there's no evidence right now of human-to-human transmission.
So you can't catch it from another person.
Not as far as we know.
Okay, good to know.
So those dairy workers in California, they
Yeah.
probably got it directly from the birds.
Direct contact.
Right. The cases we're seeing are mainly people who work closely with infected birds.
Yeah.
Or drink raw milk from infected cows.
Raw milk.
Yeah, unpasteurized milk.
Oh, I see.
But here's where things get really interesting.
Oh. Tell me more.
Dr. Vohra noticed something kind of unusual.
What's that?
Every single confirmed human case of this H5N9 has presented with conjunctivitis.
Conjunctivitis. Wait, you mean pink eye?
Yeah, pink eye. Pink eye.
Really?
It seems like this particular strain might have an affinity for the tissues in the eye.
Hold on.
Yeah.
So if I wake up with pink eye,
Uh-huh.
should I be freaking out about bird flu?
Well, not necessarily.
Okay.
It's all about context,
So if I work on a chicken farm and I get pink eye,
Right. Or if you drink raw milk and then get pink eye.
then it's a red flag.
Yeah, that's a sign to get checked out.
Okay.
But if you're just an average person who gets pink eye,
Right.
it's probably just, regular pink eye.
Phew, that's reassuring.
Right.
So pink eye aside,
Okay.
what other symptoms should people be looking out for?
Is it like the regular flu?
Yeah. Is it similar?
It is. Mostly,
Ugh.
you've got your usual flu symptoms,
What?
fever, cough, body aches,
Sore throat.
sore throat, fatigue.
Right, the usual suspects.
Exactly.
But in some cases,
Yeah,
it can get more serious, right?
it can.
Like pneumonia.
Yes, pneumonia is a possible complication.
And, let's be honest here.
Sure.
The big question on everyone's mind is,
Right.
can this bird flu kill you?
That's the big one, isn't it?
It is.
Well, while bird flu has been fatal in other parts of the world, none of the cases in the U.S. so far have resulted in death.
Okay, that's good news.
It is.
So, no deaths in the U.S. yet.
Not yet.
That's reassuring, at least.
Mhm.
So what can we do to protect ourselves?
What can we do?
Is there a vaccine?
I wish I had better news there.
Uh-oh.
There's no vaccine available to the public yet.
No vaccine.
Not yet. Research is ongoing.
Okay.
But there's nothing readily available at this point.
So we can't just go get a bird flu shot.
Not yet.
Okay.
However, Dr. Vohra really emphasizes the importance of getting your seasonal flu shot.
Wait, the regular flu shot?
Yes.
Wouldn't that be like wearing a raincoat in a snowstorm?
Not exactly.
I mean, it's not going to protect me from bird flu, right?
Not directly,
Okay.
but it can help prevent something we talked about earlier.
What's that?
Remember viral mixing?
Oh, right, the reassortment thing.
Yeah.
Where the viruses swap genes.
Exactly. If you're already infected with the seasonal flu,
Okay.
and then you get hit with bird flu,
Uh-huh.
those two viruses could potentially combine
Oh, no.
right inside your body.
And then create some new superflu.
It's a possibility.
Wow, I never thought of it that way.
It's something to consider.
So getting the flu shot is like a preemptive strike
Kind of, yeah.
against a potential viral team-up?
Exactly.
Like that. Okay, but what about food?
Okay, good question.
Can I still eat chicken?
What about milk?
Yeah, milk too. Can I still enjoy those things without worrying about catching bird flu?
That's a common concern and a valid one.
It is.
But the good news is
Good.
properly pasteurized milk
Uh-huh.
and thoroughly cooked chicken
Okay.
are safe to eat.
So I can still have my chicken nuggets?
You can, as long as they're cooked all the way through.
And my milk.
Pasteurized milk is fine.
Okay, phew.
There are lots of safety measures in place throughout the whole food supply chain
Like what?
to minimize the risk.
Okay.
For example, dairy cows are regularly tested,
Wow.
and any milk from infected cows is discarded.
They just throw it out.
They do.
Wow, that's reassuring.
Right.
So the milk you buy at the store,
Yeah.
it's been through rigorous safety checks.
It has.
That's good to know.
It is.
Sounds like they've really got a handle on the food safety part.
They do.
That's a relief.
It is. And you know what else?
What?
There's this really cool initiative happening in California.
Oh, tell me about it.
Remember we talked about Dr. Vohra?
Yeah, the ER doctor?
Yeah, he's right in the middle of this outbreak in the Central Valley.
Right.
Well, UCSF Fresno has this program.
Okay.
It's called Mobile Heal.
Mobile Heal.
Yeah, and it's a mobile health unit.
A mobile health unit. What's that?
It's like a clinic on wheels.
Oh, wow. That's cool.
It was initially created for the COVID-19 pandemic.
Oh, yeah. I remember hearing about those.
Yeah.
They were using them to provide testing and stuff.
Right, and now they're using them for bird flu, too.
Really?
Yeah, they're taking these mobile units to rural and underserved communities
That's awesome.
that might not have easy access to health care.
Right, because not everyone can just drive to a doctor's office.
Exactly. So these mobile units are providing bird flu testing,
Mm-hmm.
seasonal flu shots,
Oh, that's
and even treatment.
wow. So they're like a one-stop shop for bird flu care.
Pretty much.
That's amazing.
It's a great example of how they're adapting
Right.
and using existing resources to address this new challenge.
I love that.
Me too.
It's great to see proactive measures like that being taken.
It is. It's really encouraging.
Okay, so before we move on,
Yeah.
let's quickly recap what we've learned so far,
Sounds good.
just to make sure everyone's on the same page.
Okay, so first of all,
Yeah.
this particular strain of H5N9,
Mm.
it's not currently any more dangerous to humans
Okay,
than previous strains.
that's good news.
It is, but it's still important to be vigilant
Right.
and understand how these viruses can change over time.
They're tricky little things.
They are.
And don't forget about the pink eye.
Oh, yeah, the pink eye.
If you work with birds or drink raw milk and get pink eye,
Definitely a sign to get checked out.
right, get to a doctor ASAP.
Absolutely.
We also talked about the importance of getting the seasonal flu shot,
Mm-hmm. That's crucial.
not just for protection against the regular flu,
Right.
but to potentially prevent the mixing of
Is
viruses,
that reassortment thing?
which could create new and unpredictable threats.
Exactly.
And the food safety measures are in place,
Yeah.
so we can still enjoy pasteurized milk and cooked chicken.
Absolutely.
That's good to know.
It is.
And it's so inspiring to see initiatives like the Mobile Heal program.
Oh, yeah, that's fantastic.
They're really going above and beyond to provide healthcare access
They are.
to those who need it most.
It's a great model
It is.
for addressing public health challenges.
Okay, so we've covered a lot of ground here.
We have.
But before we move on to part 2,
Okay.
I want to leave you with something to think about.
All right, I'm listening.
We know these viruses can combine and potentially create new threats.
Right.
And this brings up a big question.
What's that?
If we know this is possible, and it's happening, how can we prepare for the future?
That's a great question.
What steps can we take now
Yeah.
to protect public health down the road?
That's something we all need to be thinking about.
It is, and it's something we'll delve into further in our next segment.
Yeah, wait.
Stay tuned.
I will.
Welcome back, everyone. So are you feeling more clued in on this whole bird flu thing?
I hope so.
I know I am.
It's a lot to take in, though, right?
It is.
There are just so many different angles.
Yeah, and you know what really stood out to me?
What's that?
That whole thing about the mobile heal unit in California.
Oh, yeah? Those mobile clinics?
It's such a cool idea.
It is. It's a great example of how we can, like, repurpose resources.
To tackle these emerging health threats, you know?
Totally.
But it also got me thinking about the bigger picture.
Like what?
Pandemic preparedness.
Oh,
Like, what lessons can we learn from this bird flu outbreak?
right. Because this isn't the first time we've dealt with something like this.
No, it's not.
And it definitely won't be the last.
Exactly.
So how can we get ahead of the curve?
Well, for starters,
Yeah.
I think this whole situation emphasizes how important early detection is
Oh, for sure.
and monitoring.
Makes sense.
We know that viruses are always evolving, right?
Right.
But if we can catch those changes early on,
Yeah.
we have a much better chance of containing things.
Containing the spread.
Yeah, and developing those effective countermeasures.
Like treatments and stuff.
Treatments, vaccines, yeah.
Okay, so like those regular tests they do on the dairy cows,
Uh-huh.
that's a good example, right?
Like crucial, yeah.
To catch those potential outbreaks before they get out of hand.
Exactly. Okay, so it's not just about testing, though, right?
No, it's about having systems in place
To do what?
to track and analyze viral data.
Oh, interesting.
We need to constantly be on the lookout for changes.
In the virus?
Yeah, like transmissibility, virulence,
How easily it spreads.
how dangerous it is.
And anything else that can make it a bigger risk to us.
Exactly.
It's like having a global early warning system
It is, yeah.
for infectious diseases.
A radar for viruses.
I like it.
But even with the best surveillance in the world,
Yeah.
communication is still key.
Oh, absolutely.
We saw that with COVID, right?
Oh, yeah.
How quickly misinformation can spread,
It was crazy.
creating confusion, distrust.
It was overwhelming.
It was, and it highlighted the need for clear communication
Moo.
from trusted sources, public health officials.
Right.
They need to be proactive,
In what way?
getting information out there, addressing people's concerns.
Right. And fighting all that misinformation.
Exactly. People need to feel informed and empowered.
Not scared and confused.
Exactly.
And that's where, like, this Medical Xpress article comes in, right? Providing evidence-based info
Yeah.
from experts like Dr. Vohra.
He's on the front lines.
It's like we're getting a direct line to the people who are dealing with this.
Exactly. And that can be really reassuring.
For sure.
Especially when things feel uncertain.
So we've got surveillance, communication.
Mm-hmm.
What else should we be thinking about in terms of pandemic preparedness?
Well, vaccine development is a big one.
Oh, yeah, vaccines are crucial.
A readily available vaccine would be a game changer.
For sure.
Yeah.
But you mentioned earlier how these viruses are constantly evolving.
They are.
Wouldn't that make it really hard to create a vaccine?
You're right. That's a major challenge for researchers.
Like, how do you hit a moving target?
That's the question.
But there are some new developments, right?
There are some really promising vaccine technologies out there.
Like what? Tell me more.
Well, for example, there's this research on universal flu vaccines.
Universal. What does that mean?
So instead of targeting specific strains, they aim to target parts of the virus that don't change as much.
Oh, I see.
So like the core structure of the virus.
Which stays the same.
Relatively, yeah.
So in theory, you could have one vaccine that would work against a whole range of strains.
Potentially, yes.
That's incredible.
It's a really exciting area of research.
It is. So we wouldn't have to play catch up with every new strain.
At the soap.
Wow. Okay, but even with a universal vaccine, we still need to get people to take it, right?
You're absolutely right. Public health messaging is still crucial.
So convincing people to actually get vaccinated.
Exactly. Addressing vaccine hesitancy.
Right, because it's not just about protecting yourself.
No, it's about protecting everyone.
Herd immunity.
Yeah, exactly.
And this all comes back to that interconnectedness thing, right?
It does. This bird flu situation has shown us how connected we are.
Connected to what?
To animals, to the environment.
We can't just focus on humans.
No, we're all part of this bigger ecosystem.
And this outbreak has also shown us something else, I think.
What's that?
The importance of collaboration.
Oh, absolutely.
Like we've seen public health officials, researchers, veterinarians, farmers.
Even those mobile health units.
All working together.
It takes a village, right?
It does.
To tackle these complex health challenges.
So pandemic preparedness is like this big puzzle.
It is, with lots of different pieces.
Surveillance, communication, vaccines, collaboration.
It's a lot to juggle.
It is, but it's also an opportunity, right?
An opportunity for what?
To learn and adapt and build a better system.
That's the goal.
A more resilient system.
For sure.
Okay, before we wrap up this part, I want to leave you with another question to think about.
All right, hit me.
We've talked a lot about the health implications.
Yeah.
But what about the economic impact of this outbreak?
Oh, that's a good point.
Like the dairy industry.
Right. They've been hit hard.
So the question is,
Yeah.
given these economic disruptions we've seen, what steps can we take to, like, soften the blow?
Soften the blow of what?
Of future outbreaks. Of zoonotic diseases like bird flu.
That's a big question.
It is. Something to ponder as we move into the final part of our deep dive. We're back. Part 3 already. Can you believe it?
Time flies when you're having fun, right?
Seriously. It's amazing how much we've managed to unpack from just one article.
Right. It speaks to just how much information is really out there.
And you know one thing that's really resonated with me throughout this whole conversation?
What's that?
This whole idea of interconnectedness, you know?
Absolutely.
It's come up again and again.
It has, hasn't it?
Like, we can't even talk about bird flu without talking about human health, animal health, the environment.
It's all connected.
Exactly. They're all completely intertwined.
Like that butterfly effect you hear about.
Oh, yeah.
One little change somewhere can cause these huge ripples everywhere else.
Exactly. And we've seen it happen time and time again.
You have.
With all these zoonotic diseases like HIV, Ebola, SARS, and now bird flu. It just shows that we can't ignore the health of the planet and everything on it.
We're all in this together, whether we like it or not.
Right. And it's not just about physical health either.
Oh, no, definitely not.
Think about the economic impact.
Huge.
Disruptions to the poultry industry.
Yep.
Food safety concerns.
Yep.
Resources being diverted to deal with the outbreak.
It adds up fast.
It does. Remember how you asked about mitigating those economic impacts?
Yeah, I do.
Well, what if we could actually use these outbreaks for good?
What do you mean?
Like, what if instead of just reacting, we used them as opportunities to make things better?
Oh, I like that.
Turn a negative into a positive, right? For instance, this whole situation has shown just how important sustainable farming is.
It really has.
So maybe this is a chance to invest in more resilient systems.
That prioritize both human and animal health. And it's not just about farms, is it?
No, it's much bigger than that.
What about investing in research and development?
Yes. For new vaccines, new treatments.
Not just for bird flu, but for all sorts of potential threats.
Right. Like, imagine if we had that universal flu vaccine we were talking about.
That would be a game changer.
It would. And what about improving those global surveillance systems?
Oh, yeah, that's crucial.
We need to be able to detect and track these new diseases
quickly,
efficiently, so we can prevent them from becoming pandemics.
It's like a smoke detector, but for diseases.
Exactly. And of course, public education is a huge piece of the puzzle, too.
Totally.
We need to make sure people have the right information.
Give them the tools to protect themselves and their communities.
Exactly.
It's about creating that culture of health, literacy, and responsibility.
So while this bird flu thing has brought a lot of challenges,
It has.
it's also given us this opportunity
To learn.
to adapt,
To build a better future.
to move past the fear, and see that we have the power to create a healthier world.
For everyone.
So as we wrap up this deep dive, let's leave our listeners with something to think about.
Okay, shoot.
We've talked a lot about this interconnectedness, right?
Yeah,
Human, animal, environmental health, it's all linked.
totally.
So the question is,
Yeah,
what role do you see yourself playing in all of this?
that's a good one.
What can you do, even in a small way, to contribute to a healthier future?
Something to think about.
It is. And as always, stay curious, keep exploring, and never stop learning.
Couldn't have said it better myself.
Thanks for joining us on The Deep Dive.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.